All right, so this is my presentation on bone injuries of the knee. Here's some of the contents we'll be going over in this presentation and the introduction. So, bone knee injuries are far less common than many other injuries to the knee, such as meniscus tears, ligament tears, and so on. However, they are injuries typically having to do with the patella, the distal femur, the proximal tibia, anything in that general knee area. I'm going to focus on the most common fracture, which is to the patella. It acts as a shield from the knee and takes a lot of head-on impact. According to the British Journal of Sports Medicine, about 41% of all sports injuries are knee injuries. Of course, this statistic does include meniscus tears and ACL, all those sorts of injuries. It shows how common knee injuries are. Most patella fractures are going to be closed fractures. The bone shards do not break through the skin. There are, however, some cases of open fractures where the bone does pierce through. Etiology. So, bone knee injuries are most commonly caused by a direct impact to the patella that causes that fracture in the bone. Risk factors are going to be behavioral mostly, but there are other risk factors such as weight. It stresses the knee joint, it pushes that patella a little bit forward. It can cause extra impact on the knees and it can weaken that structure. Another risk factor is going to be having a disease that weakens bones, such as osteoporosis. And there are environmental factors. You could work somewhere that there's things moving around that are low near your knees. You could work somewhere that has a lot of things that your knee could make contact with. And that hard contact could be what causes a fracture. But as previously stated, the biggest risk factor is going to be behavioral. The patella will break on a hard impact. So things like contact sports, car accidents, those can put you at risk. And then AI can be a major part in detecting as well, can make sure that those fractures are detected. As for demographics, knee injuries are going to, especially of the bone, are going to be more common in men than in women. Actually, they're more common in women when it comes to your ligaments, but with bones being based on that contact, there tends to be a bit more force in the impact in men's sports. The most common age range for knee injuries is going to be between 25 to 44 years. That is when the aging of knees can really be felt, but physical activity still tends to remain really high. So we're doing a lot of physical activity, even though those knees are getting weaker. Fractured patellas account for nearly 1% of all fractured bones in the United States. That was the only really stat in the United States that I could find, but that does show how common it is as a fracture. Basketball and soccer players tend to have the highest rate of patellar fracture due to constant high-speed collisions, lack of protective gear. For soccer players, it's usually player on player; they'll collide. Basketball players, they usually fall down onto the court. That can definitely cause a high impact. Over here, we see a Liverpool player named Alex Oxlade-Chamberlain who suffered a knee injury after clashing knees with another player. It took him out for 10 months. It took him a while to recover from that. As for anatomy, the knee is a very, very complex joint. The patella is that shield in the very front of it, as we can see with the diagram. There's a lot of things behind it. The knee is right at the meeting of the femur and the tibia, and there's no real system affected by a fracture of the patella. It could really affect some things through like infection or through shards, but for the most part, it's just going to be the skeletal system affected. The most affected tissues behind the patella are going to be that ACL, patellar ligament, and the articular cartilage. Those will be affected because shards could go into them. Their shield is broken. There's going to be pressure in there. And it kind of leaves them a little bit defenseless. It's going to strain that ACL, and there could be real problems because the ACL is a major stabilizer of the knee. As for physiology and symptoms, a patellar fracture does disrupt the knee in many ways. It's going to cause a lot of swelling and a lack of movement. It's not going to be held in place very well, and obviously damage to any of those ligaments is not good either. And sometimes the bone just doesn't want to heal properly, and we're going to need different options of just waiting. Symptoms of a patellar fracture are going to be pain, general pain, You're going to have bruising and really bad swelling. You're going to have an inability to bend or straighten the knee. You're not going to be able to hold it straight. You're not going to be able to bear any weight or walk really. And if you are, you're going to have a really bad limp. You're going to have a deformed appearance of the knee. And there's, in some cases, with open fracture, you can have the bone protruding from the skin. These symptoms occur because obviously the patella fracture in the body swells up to react to that. Swelling and general pain in the area are going to keep it from being very usable. Failing to seek treatment for a fractured patella could lead to limited use of the leg in the future. You can have pain in the knee, it could heal wrong and have lasting aching and not be able to straighten properly. Especially with open fracture, infections could happen as well that could lead to more complications down the line. There have been no recorded deaths because of a patellar fracture. However, like I said, infection, we always know that can be deadly. So we would like to treat it. And so for the diagnosing a fractured patella usually starts with a few questions. Find out the nature of the injury. Was it sports related? Was it a car accident? That will help to put ideas into a doctor's head. They'll do a physical exam where they will physically observe the knee. They're going to touch it. They're going to look around and feel it. Look for any deformities that can be felt. And then obviously x-rays, the most common one. They're going to go and look at that bone and search for fractures. And that is where AI can come in handy to identify certain fractures and identify severity. Treatment for the patella fracture, depending on the severity of the break and the condition of the patient, we can go with either a surgical or non-surgical option. For the non-surgical, we're going to cast and splint. We're going to give you some crutches or a wheelchair. We're going to prevent that weight bearing. Going to give you some pain meds. And once that starts to heal, we're going to give you some physical therapy so that we can get some mobility back in there, because there will be some atrophied muscles because they're not going to be doing much work. Surgically, if the break is really bad, we're going to get some screws, pins, and wires. We're going to hold larger pieces together. And then we're going to remove fragments that are just too small. That's where that healing is going to come back together. And then we're going to address the damage to the ligaments and other structures, make sure everything in there is good. There is very few risks. We are pretty good at knee surgery at this point. We know what we're doing in there. And so obviously everyone reacts a little bit differently, but we're pretty good at going in there. And in most cases, a patient will just need physical therapy to get movement back. And then they're going to have some general pain and soreness that comes with having a knee surgery. And there are my sources.